Okay, before you start, Farnaz, let me introduce. It's my pleasure to introduce our next speaker which is Dr. Farnaz, who is our latest addition to the department, and she will be speaking on the postpartum weight loss. And over to you, Farnaz.
Thank you very much for the introduction, Prof. Mukhri. Okay, right. So today's topic, I'm going to talk about breaking the cycle or holistic approach to preventing postpartum weight retention. So why did I choose this topic? Now, as we know, Malaysia, more than 50% of Malaysians are now either overweight or obese, and it's found that there's more overweight or obese women than men. And a topic that's not often talked about is the impact of pregnancy on the weight of women and how postpartum weight retention is a major contribution to obesity among women. So, looking at this slide, we're looking at the timeline of a woman from the time of her reproductive age phase up to the time when she passed at the reproductive age. So, during her first pregnancy, it is common to have gestational weight gain, and this lead to an increased BMI, an increased fat mass, and also visceral fat. And this weight is retained after delivery. And subsequently, um, the during the second pregnancy, to the weight that was retained causes an increase of preconception BMI, and this would also lead to another higher excess gestational weight gain, fat mass, and visceral fat. So this then uh, causes another problem, metabolic consequences for this patient. She has a risk of diabetes, gestational diabetes mellitus, preeclampsia, and hypercholesterolemia. So, what is exactly the meaning of postpartum weight retention? So, postpartum weight retention refers to the failure to lose weight gained during the pregnancy within 12 months of childbirth. Now, it's important to acknowledge this because it can lead to long-term health outcomes, such as increased risk of obesity later on out of pregnancy, metabolic disorder, cardiovascular disease, and also not to forget mental health. And as you can see, as this woman goes along um, through the phases of her life and later in life, she retains those weight gained from her pregnancy. She was never able to lose it. So she has a higher BMI, higher fat mass, higher visceral fat. And the severity of the metabolic consequences can be seen when this woman then develops type 2 diabetes, heart problem, cardiovascular disease, hypertension, metabolic syndrome at an early age of their life. Now, I want to highlight that I want to talk about what are the causes of postpartum retention. And before I do so, I also want to highlight that this is a topic that is not new to the academics. There have been studies done exploring postpartum weight retention. And one of the studies that is uh, familiar is the cardio study. So in this cardio study, it's a longitudinal study where it looks at a community based in the States, and they look at the coronary artery risk of development of young adults. And they also included primates, so women who have not delivered yet, and compared to women who have, primates, women who have delivered compared to women who have not delivered. And it was found that primates within the races that they have recruited had gained 2 to 3 kgs more weight during the 5 year period compared to the non-libs in both adjusted and unadjusted analysis. And these primates, meaning women who have more than one child, they have greater increased waist to hip ratio um, uh, sorry, compared to those who did not have any children. And this also increases as the women had more pregnancy. So this data suggests that women experience adverse increase in body weight and fat distribution after first pregnancy, and that these changes are persistent. So gestational weight gain is something that uh, has been a problem to women, not just in Malaysia, but also worldwide. And another study I wanted to highlight was regarding a spawn study. So this is a study done in Stockholm, which compared the weight gain of women during the first and second pregnancy, and they showed that the pre-pregnancy BMI does not really prevent a woman from gaining too much weight during their pregnancy, and that overweight women compared to a woman who had normal BMI did not gain more weight during pregnancy or retain more weight at 1 year after follow-up. And the high weight gainers who were women who gained a lot of weight during the pregnancy, they were more likely to retain their weight after a year delivery. So women overweight before pregnancy did not have any higher risk of postpartum weight retention than normal weight women. So why I included this is because this is not just a problem for women who were already overweight to begin with before embarking into the pregnancy. Is also a problem that can be for women with a normal BMI, hence highlighting the importance of understanding the impact postpartum weight retention. Now, going back to the slide I showed earlier, the timeline of a woman from the reproductive age and from the later on in the life, again, I highlight that the metabolic consequences for this woman later on in the life is severe. They have a risk of type 2 diabetes, cardiovascular disease, metabolic syndrome, and they can develop it in their 40s instead of 50s, much earlier. And this is another study that shows the impact of postpartum weight retention and the risk of hypertension and cardiovascular disease on this woman. And this cohort study was done in Denmark. So what this study shows that if a woman was able to lose the postpartum weight, the risk of cardiovascular disease, hypertension, was severely reduced by 25% to 30% compared to those who couldn't lose the weight that they had during the pregnancy. In fact, if the weight gain was more than their two BMI units, they had about almost half, 48% of risk of developing cardiovascular disease later on in their life. So this existing studies highlights the importance of us to acknowledge that postpartum weight retention is an issue, and as a clinician, is something that we should address and talk about more with our mothers and new moms. So I just want to talk about the basic science of it. So the physiology that happens during pregnancy. And not to say that the weight gain is just purely the mother, but we have to acknowledge that the weight gain is also due to the pregnancy itself. And if you can see at this picture I showed here, there are weight gain from the breast, from the uterus, from the placenta, from the baby. Baby can weigh up about 3 kilos, and as we know, the physiological changes for pregnant women, there's an increase of blood volume that can add on about 1 to 2 kilograms. And the excess fat now can be about to 4 kilograms. So if we're looking on an average normal weight gain, we would say by pregnancy itself, it should be about 16 kilos roughly. And I want to talk about again the basic science. What is the metabolic adaptation that occurs during pregnancy? Early pregnancy and later pregnancy is slightly different. So the excess fat storage during pregnancy is primarily driven by metabolic adaptation that occurs early gestation, where the increased insulin sensitivity actually promotes lipogenesis and fat deposition. So in the early pregnancy, pregnancy, there's actually insulin sensitivity. However, changes as the pregnancy develop and the insulin resistance develops due to the growing placenta, and the placenta starts to release human placenta lactogen, placenta growth hormone, progesterone. So this initial lipolysis then shifts, making the stored fat primarily the maternal energy source while preserving the glucose and amino acids for the fetal growth. So, excessive fat accumulation in early pregnancy, often influenced by maternal diet, can exacerbate the insulin resistance. So, this can increase the risk of gestational diabetes and has impact on the baby fetal overgrowth and long-term metabolic dysfunction for both mother and child. So, what I want to highlight is that yes, it is normal for the mother to gain weight, gain fat during the pregnancy, but there is a huge myth that I would like to debunk. And this myth is commonly said by many to moms, which is eating for two. Now, the truth is, during the first trimester, the calorie intake doesn't really change as much. You are supposed to eat as you did before during your before your pregnancy. And a rough calculation on calorie in the second trimester, the calorie increase is about 300 to 350, and the third trimester is about 400 to 450. Now, what I want to highlight about this myth 1842 is that we should mothers do not need to excessively eat and get worried that if they don't eat, the baby don't grow. However, I would highlight that calculating calories can be extremely difficult, and also the recommended weight gain in pregnancy, it's based on a study that was done mainly in the States and may be a variable and hard to implement in a population like Malaysia, where we are not mainly Caucasian. So the general new rule now that is recommended by the American uh, Obstetrics Academy is actually for encouraging the mom to eat healthy, balanced diet and ensuring that the fetus is growing well, whilst monitoring the mom's weight and also the risk of developing diabetes and hypertension during the pregnancy. Okay, so I want to talk about the risk factors for postpartum weight retention. So, as I mentioned earlier, the average weight gain during pregnancy is about 16 kilo, but we are talking about a woman who have a normal BMI. So, the risk factors for the woman to retain weight postpartum is dependent on the pre-pregnancy BMI. There is no denying if a woman was overweight and obese to begin with, they're more likely going to retain the gestational weight gain. And we know that when you're pregnant, it is not conducive to as our mothers to have a strict diet. We can only advise them to follow a diet that is well balanced, but it is not advisable to ask the mother to lose weight. Okay, so because of this, if the starting pre-pregnancy BMI is normal, then the likelihood of postpartum weight retention will be less. If it's higher, then there's a likelihood of higher postpartum weight retention. Another issue is to talk about another risk factor causing postpartum weight retention is the gestational weight gain itself. If the woman, again, believing that myth eating for two is eating all the time during the day and wakes up at the night having craving, which I understand can be related to hormone changes, this can also lead to excessive gestational weight gain, which would then contribute to the postpartum weight retention. And there's another two more factors I would like to highlight. Age. As we know, nowadays women are getting pregnant later on in their life. in their life compared to the generation before us. For example, if we talk about our grandparents or even our parents, it was very normal for them to get married in the 20s, mid 20s. But now it's becoming more common for women to get pregnant in the mid 30s, and it's related to women being in the workforce, focusing on their career, and also um, economic situation. Now, this is all closely interlinked to each other. Another thing is about socioeconomic and lifestyle. Now, obviously, if you have a busy lifestyle, making the best choices of diet, of your food habit, it's going to be difficult. And if it is easy if you were to resort to processed food, high sugar food, which is easily available and also in comparison not as expensive as if you were to buy a cooked meal from a restaurant. And as you know, Malaysia, we are one of the most obese nation in the Southeast Asia, and it's not a shock because our food is amazing. In the morning, everyone is rushing off to have roti canai and nasi lemak. So it comes down to that the lifestyle factor here in Malaysia. Okay, now I talked about the factors that may lead to postpartum retention. Now, I want to talk about what happens after the delivery. So, what are the factors after the delivery that can contribute to postpartum weight retention? So, one of the thing is hormonal changes. After delivering a baby, the postpartum hormonal fluctuation can increase hunger and affect food preferences, tipping the woman to want to have more high sugar, high carbohydrate meals. And this would it would make it more difficult for the woman to have a balanced diet, to shed the weight that was gained. Another thing about breastfeeding, I would like to highlight about the myth around breastfeeding. Now, a lot of community and social media has highlighted that yes, breastfeeding will shed the weight that you have gained. It's a calorie burner, but there's something that needs to be highlighted about breastfeeding. Breastfeeding, yes, it uses up a lot of calorie, but it also causes an increase in appetite and also causes the woman to eat more. And this is a natural mechanism for the woman to make sure that the lactation supply is enough. If a woman were to go on a strict diet or strict exercise, it's no doubt that their lactation supply would reduce. So this makes it really difficult for a breastfeeding mom to actually lose the weight gained during the pregnancy completely. And not to forget sleep deprivation. Handling a newborn, it is no doubt that you are not going to be sleep. You will be waking up too hourly for night feeds, consoling the baby. So sleep deprivation will also cause the mothers to be stressed and affect their hunger hormones, the ghrelin and the leptin, potentially leading them to overeating. And uh, at the top picture there, I put an ideal picture of what motherhood would be after delivery. It would be lovely if the mother could exercise with the baby and lose the weight and get back in shape. But in reality, postpartum fatigue, coupled with demands of caring for a newborn, it is almost inevitable for you to be active and have time to exercise. You're focusing on your child, and it becomes even more difficult if you have more than one children at home. So this slows the weight loss. So the topic today is talking about holistic approach managing postpartum weight retention. Now, I want to highlight that the current evidence at the moment regarding management of postpartum weight retention is scarce. It's not abundant at the moment. And an existing resource from Cochrane Library that did a systematic review did look at how postpartum weight retention can be managed either by diet or with diet and exercise. And it found that there was no difference in the outcome when diet was used alone or diet coupled with exercise was used. Why do I highlight this? It means that the management for postpartum weight retention is not a single method. It's a multifactorial issue that we need to target as a clinician. And it's really important, not just for the obstetrician to be caring for the patient during the pregnancy, but to also be working together with other multidisciplinary teams to manage the mothers after their pregnancy as well. So, what do I mean by holistic approach? Holistic approach is a balanced approach, ideally, and is individualized for the patient, which includes nutrition, targeting their physical activity, the mental well-being, targeting their stress levels, sleep, hormonal balance, and also not forgetting the social support. So it's not a single method solution here. So it all first started not before pregnancy begins itself. And with pre-pregnancy counseling, it's very important for obstetrician to encourage the woman to have weight reduction if they're overweight or if they're obese, and also not to forget if they have any medical problems, metabolic endocrine disorder, for us to optimize their diseases before they embark into their pregnancy. Another thing to talk about with our patients, especially once they have delivered, is talking about the increasing the interval between pregnancy. Now, um, based on a large cohort study done, individuals were compared, individuals who had short intervals between their pregnancy and large interval between the pregnancy, and it showed that those who had short intervals between the pregnancy were more likely to have to retain their postpartum weight retention, and it significantly increases their risk of preeclampsia, gestational hypertension, diabetes, and even cesarean section because of diabetes complicating the pregnancy, leading to a larger for gestational age fetus. This all happens in the woman's second pregnancy. So it is important for the obstetrician to talk about good family planning. A larger interval between their pregnancy can help them optimize their pre-pregnancy health before they embark into another pregnancy. Talking about diet, as we know, this is not easy, and it's easily said, easily to for us doctors to advise our patient. But we know even for ourselves, it can be a struggle. But the important thing I want to highlight here, which I feel we should take advantage more of, is actually working with a dietitian, not only when we have a pregnant woman with diabetes or any endocrine issue, but also working with them to educate this woman about balanced diet even before they embark into the pregnancy and after the delivery, because when they have a good nutrition education, they're able to make better choices for their food and have better food habits, which will then help them manage with their postpartum weight retention. So having a balanced nutrition and also avoiding crash diets, this is all important for them to have a sustainable weight loss after their delivery. Another thing to also highlight is about mindful eating, which is something that is not commonly practiced or not commonly talked about, and it's something that's worth working with the psychotherapist, and also encouraging a woman with weight problem to think about cognitive behavior therapy, which can help them to have better habits and have more mindful eating for their food choices. So the next thing we talked about diet. Now let's talk about physical activity. Now the thing that I want to highlight about postpartum, especially when a woman had a difficult delivery, be it vagina delivery, but even cesarean section. So, cesarean section is abdominal surgery. So it would take time for the woman to recover and to be more active. Now, I think it's very important for us to liaise with the physiotherapist and even the sports medicine if we know that this woman is obese and they have joint problems or they have mobility issue. It's important for us to actually work with them and come up with a plan for the patient to have at home that is not so strenuous for them. As we know, postpartum, the recovery would take time. So I don't expect my pregnant moms after delivery to straight away go to the gym and be jogging around the neighborhood. But I think it's important for them to know the right exercise, doing light exercises that can be done easily at home. And if they need specific education on mobility, posture, the type of exercise they can do, this is when it's important for the obstetrician to liaise with the physiotherapy and the sports medicine. And talking about postpartum exercises, strength training and cardiovascular exercise is without doubt one of the best way for not just postpartum women to lose weight, but for anybody. Now, the thing again I want to highlight is that another myth. The first myth was eating for two, and the second myth was is breastfeeding makes you lose weight. So solely depending on breastfeeding should be to lose weight is a myth and should be debunked. And new moms should be educated about this, that they have to have a balanced diet so that they can have good lactation supply at the same time, trying to also not gain any more excess weight from overeating. So I highlight this because it's becoming more common and it's getting marketed even more with women buying lactation cookies, high sugary cookies, which I find that will actually contribute more for the weight gain and also increase the risk of developing diabetes. Okay, so the last issue I want to talk about is the psychosocial support. Okay, so when a woman gives birth, their spouses, their family, their friends are the social support. Now, if they have lack of social support, it's going to be very difficult for them. It's not it may not be directly related to their weight or having the ability to lose weight, but it's more related to having the extra help around the house, having the extra help to take care of the baby, having more time for them to focus on their health, not just the physical health, but also the mental health. And I don't think that all women have this privilege of having an extra support system at home. And it can be also if, as you know, nowadays, in a household, the wife and the husband are both working, and it may be that they don't have the privilege of having their family or in-laws to help them. So to hire help, having a maid may be expensive, and this is not something that a lot of women can afford. So there will be other ways that we as a clinician can support them for. We can introduce them to social support groups. They can have mommy groups, and this could actually help them, encourage them to have the motivation to be more healthy and also um, uh, try to lose the excess weight that they have gained. Another thing I put there, it's about mental health. So addressing psychological challenges that new mothers face, including body issue and postpartum depression, is something that I feel needs to be talked about more. And it's not talked about more by clinicians because often what happens is our patients deliver, then they return back to the community, and then the midwives handle them unless of course they're high risk pregnancy and then they come and see us again. So there's something that we need to do. We need to talk about mental health before our new moms go back home. We need to highlight that uh there is services available for them to help them to manage with the challenges that comes with being a new mom. And this is all really important because indirectly it will link to their eating habit, their choice of eating, their choice of diet and their lifestyle. Okay, so this slide is a bit of a controversial slide because there's lack of evidence regarding this. As you know, um, uh, during trials on pregnant women or moms who are breastfeeding is not as commonly done. And another thing to think about is about pharmacological treatment, medication for weight management. And this may be suitable for some women who just delivered who are facing a hard time with their postpartum weight retention, and they have metabolic consequences from this massive weight gain that they got from the pregnancy. Now, the issue is that the pharmacological treatment, as we know, the famous ones I'm sure you have heard about, Saxenda, Ozempic, it's not well studied in women who are breastfeeding or postpartum. So it is something that may be considered, but it's not advisable for new moms who are breastfeeding. But if in the context of a woman already suffer from severe metabolic consequences, this may be an option, and this may be something to discuss with a caring physician. Now, I want to talk about a patient that I myself have seen since I've been working here in PPUM since 2017. I have the privilege to meet patients who have delivered with me not just once, twice, but also three times. So that is the beauty of being in practicing in one center for quite some time. So this is a patient of mine. So I'm just naming her Madam Amina. So she came to me when she was 34 years old, and it was her first pregnancy. Her first pregnancy, she did not have any issue. Despite her pre-pregnancy BMI being overweight, she had a height of 54, and her weight was about 60. So her BMI was roughly about 25. Pregnancy was uneventful. She passed her oral glucose test twice. She had good blood pressure. She did not develop preeclampsia, and she had a successful vaginal delivery at term. And in total, when I saw her when she delivered, she gained a total weight of 20 kilos. So from being about 60 kilos, she then now weighs 80 kilo post delivery. And after this, she came back for her follow-up with us, and I soon found out that during her postpartum period, she managed to lose just about 3 kilos within 3 months. So roughly making her weighing about 77 kilos. So how do I know this? Because she was not on any contraception post-pregnancy. The reason was because she had history of PCOS and it was very difficult for her to get pregnant. See, she got pregnant at 34, but she was married for about 6 years and she did not have any successful pregnancy beforehand. So she did not think that she needed contraception. So with God's will and blessing, she got pregnant again less than 6 months from her last delivery. And her pre-pregnancy BMI was higher than before, from a BMI of 25. Now she's 32, making her class 1 obesity. So during this pregnancy was different from her first pregnancy. Unfortunately, she developed gestational diabetes mellitus during the pregnancy, and because of her lifestyle as it is, she is a professional. She works in a corporate law firm. She was very busy and couldn't manage her diet well. So from her pregnancy, pre-pregnancy weight of roughly being 77, she then gained about 15 kilos. So her BMI went up to 39 kilos, and her pregnancy was also complicated. She had gestational diabetes, was poorly controlled, and her baby then became large, and she was subjected to a cesarean section. Now, because I've also delivered her second pregnancy, I managed to keep track of this patient, and I know that after the delivery, she went for her 6 weeks follow-up in Clinic Kesihatan and in the community clinic, and she did her postpartum oral glucose test, and she was actually found out to have type 2 diabetes. And it's very sad because at this time she was roughly around 37 and 38. So this is very early age to develop type 2 diabetes. So this case study just highlights how one pregnancy can spiral to another pregnancy, making the pregnancy more higher risk, more complicated, and that complication, the consequences of this weight retention leads on for the patient to have metabolic disorder after pregnancy. And it's very sad because if pre-pregnancy counseling was done for this patient, if she had a better weight before the pregnancy, or if there was a better spacing between the pregnancy with good contraception advice, she may not actually have developed such a drastic weight gain and may have not developed this type 2 diabetes at an early age. So, the conclusion, the take home message from my presentation today is that postpartum weight retention is multifactorial. It's related to the hormones, to the lifestyle, pre-pregnancy health, all contributing to the outcomes of the patient. So a comprehensive and individualized approach is very essential. And working between multidisciplinary team is also a core for this holistic approach. Now, obviously, prevention is better than cure. So, promoting a healthy pre-pregnancy weight, active lifestyle, balanced diet help prevent excessive weight gain during pregnancy and reduce the risk of retention postpartum. And I feel that as clinician, this is something that we not only should talk about more, but should also practice. We should advocate young girls and also men. Also not to forget men, but we're focusing on moms now. But young girls to take care of their health, to take care of their eating habits, the lifestyle, so that they know that this is all important for their fertility, their reproductive health, and also for their pregnancy health. Another thing I want to highlight about is support and education. It goes a long way. Educating our patient regarding lifestyle choices, regarding the consequences of having unhealthy lifestyle, bad habits of eating, and the impact it has on them is crucial. And also providing support group for their mental health, for the physical health is also important so that not only do we help them for their current issue, but it's also for their long-term well-being. Okay. And this is the end of my presentation. Thank you very much for tuning in so far.
Okay, thank you, Farnaz. A very comprehensive presentation, and I think a very good case discussion too. And I think we now know the importance of postpartum weight loss and not to retain any weight. In view of the time, so I don't think we have time for question and answer, but everyone can see the Q&A and Farnas can answer the question. And thank you, Prof. Tunku Sara, who is actively asking question there. But I think we have to move on, and we need a clinical work to do. And I have to close the session. And hopefully that we can better manage patient postpartum. So thank you very much, and thank you for attending the UM Health breakfast. Assalamualaikum warahmatullahi wabarakatuh.